of all the money spots, I think this one, and maybe the one we'll get to later in the video, is probably the most important. If I had to treat two, this is one of the two in the hip, isn't it, man? Yeah. Just it just has such a profound effect. It releases so much pain or discomfort, or if you're feeling like you just can't bring your hip up or in, you release here. It just gives this whole freedom of range and just this. G'day guys, Darcy Ninja here for my first video of 2025. Today we're focusing on the most important area of the body that I enjoy treating is the hips. And there's 7 money spots that I'm going to show you a fast track pace version of. Basically, I treat this at least 4 times a day on my clients. I'll treat their hip flexors and their groins and their lower back and their TFL at least on 3 to 4 people. And these people are everyday Joe Blows, to your athletes, to your footballers, to people that are sitting at a desk job. So what we're going to start with is number 1 is our psoas. So our psoas attaches onto our lumbar spine. It's a hip flexor. I'm going to give you a little bit of anatomy and also show you then how to treat it. Because those following along, I reckon you can even have a go at treating your partner, or maybe you just want to watch because you enjoy learning and seeing what it's like to go through a real life treatment. So our psoas, we come in pretty slow because it's a nasty point. You know, you've got abdominals and intestines and organs all through here. So we want to go in pretty slow and just let those get out of the way until we can connect on to our psoas there. So Ninja's going to be our dummy and our receiver, and he's just going to give me little signs of when I'm on the right spot, which is...
Yeah, man, I can feel that.
Already
you're onto there, so into the insertion, I can feel
a referral point, associated pain. So I'm not even that deep at the moment, which is highlighting to me that Ninja needs this work. You know, he needs his psoas released. He's had a lower back hiccup 2 months ago, a month ago. So we know that if you've had acute lower back pain or chronic lower back pain, you want to treat the muscles that attach onto those onto the spine, and our transverse processes and this side of the spine. You're going to have connection points of our psoas. So from L1 all the way to L5, we have origin points that then go into the inside of our lesser trochanter. So greater trochanter's on the outside, our lesser trochanter's are really, you can't really access that bone, but basically the inside of your hip is where it inserts to, and that's where Ninja can feel the pain referring to. So we know we're on the psoas. Sometimes you can bring the leg up and raise that to feel the tissue underneath your hand, but for now we're just going to pin that and then sort of change maybe angles working back in towards his pelvis, his ilium there, or maybe we want to push away and go. Sometimes people get quite solidified through here right next to the spine. Like, it's so solid and hard. I had a client that I've been working with, she's a netballer, and she had a lot of pain in this area, and she complained of like stomach or intestinal sort of pain. She wasn't sure if she was a bit backed up or whatnot, but anyway, I had a little bit of a feel around in there, and there was this like really thick solidified band right next to her belly button, and I've felt it on other clients before, but this was more a like probably one of the most chronically tight hip flexors I've felt. And what I did was I peeled it away from the spine, and she went and did a yo-yo beep test, and she was like, I'm so grateful that we found that, because that has relieved so much pain and discomfort that she'd been feeling for months. So Ninja in his last video was talking about tapering your treatment to that person. You know, there's no cookie cutter approach to body work. You have to taper it. And that meant for her finding the right spot and working what felt like really solidified tissue and dissolving and melting that away. So bodywork can be amazing at discovering people's pain and they didn't even realize what it was, and it's just a tight psoas, or maybe she was a bit backed up. This stuff you are actually going to be pushing on. This is our descending colon on the left side, so I am actually directing my stroke really slowly towards the colon, like downwards as well. ascending up on the right, descending on the left. So working that down is going to help with clearing some of the gunk and the blockages as well that you might be feeling through there. So there's our psoas. I don't want to spend too much time. I'm going to come over here, Leo. You stay there. I'm going to show you iliacus, which ASISs, which you can see on Ninja here, palpating those two bones. We're going to come in with my left thumb for his left hip. And I just come in there, and you can see that if I can get that bowl of the ilium. Leo, if you can grab that pelvis for me, and I'll show you exactly where I am. So pelvis, think that's a nice bowl shape. I'm just pushing in there. Our ilium comes in, and it's a really thin layer of muscle on the inside there. So good little bit of anatomy. We're coming in, and then, yeah, Ninja's pretty tight, pretty sore. We don't need a lot of pressure. If I was just to go, nah, stuff him, he needs it, and really gave him all this pepper, it's just going to be detrimental. You're going to actually send him further backwards than going in the right direction. So go to where your client's needs are. Don't be too invasive. Allow him to breathe, and then you can really slowly, as we hold that pressure, get a little bit deeper, a little bit deeper, a little bit deeper.
That's probably a really good point when you're working in here. Like, it's the word invasive, like, we're not used to it. Most people aren't used to having pushed into their stomach. It's like a vulnerable area. So that's why you got to talk about the anatomy and kind of build trust and kind of go slow, so that gives them a chance to accept it. Because if you kind of don't go too fast, you can go freeze up and fight and kick it out. So, and you can not take advantage of the work. You won't get full results because you're just kicking it out. So yeah, it's really important to talk about it.
And it's something on day one. Ninja does a mentorship course. He's about to start his 4th intake.
Sixth.
Yeah,
6.
Wow, he's been doing it for so bloody long. I've forgotten how many he's done.
Number 6 coming up. Yeah.
Wow. So is this 1, 2, 3rd year? 4th?
Yeah.
3rd. Wow. Okay. So in those intakes, number 6, number 4, he goes through the importance of melting the tissue and going in slow, and cornflower approaches and our philosophies. And still to this day, they sing true. They're still something that I consider and think about and go back to that day one, because it's just simple but effective. So if you want to upskill your level of bodyworks and hand-on treatment, there's a mentorship course. It'll be in the link below. You too can learn these philosophies and concepts that are going to keep you on the right trail when you feel like, oh, I'm a bit lost, or I'm not sure how to treat that. We just simplify it, go back to those key concepts. Yeah. So sink out is another one.
Yeah.
Psoas, iliacus. There's 2 nut money spots. Next one I like to do is pectineus, which is up in here. Okay, so quad tendon is this really ropey one. Think about a big, thick quad through there, our most dominant quad. We're going to come medial to that, and it's right next to a gland. And so we're going to make sure, again, we're going in slow. And this little guy, this little pectineus, is an adductor, but also a hip flexor. I find it gets angry, and it's like a hip crease pain. Like you feel like, I don't know, you can't propel forward, you can't sprint or take off because you've got this nagging hip pain that you're just like, I don't know, maybe find yourself pushing your thumb into. Pectineus, nice little guy that we like to push into with the thumb. Yeah. How's that feel for you?
Yeah, you're on it, man. Nailing it.
It's a bit sharp, or a bit like electrical sometimes. That's okay. Just go slow. Build trust. And pin and hold. So pinning and holding is what I've done from the 1st to the 2nd to the 3rd muscle, and I find it's the most effective way of releasing taut tissue or tight tissue. None of this quick, fast strokes with oil and this sort of stuff. It's just pin it, wait for what's like, if we were to picture something that's really bound up and tight, and then it just slowly lets go. You know, it was just to let go. So that's what I feel like happens under my thumb, or I get this, I get a little kick out of it. I get a little, there's nothing left in there. The tissue feels soft.
Yeah, it's awesome, isn't it?
Yeah.
To feel it.
Yeah.
Feel it change.
Yeah.
Whoa. It's good, man.
The thing is about money spots, and why I want to show you guys these, is because I am doing it every day and I feel like it is effective and I get a lot out of it, is also bang for buck. A money spot's a money spot because you can pin and hold this one area and it has a flow-on effect. So this is going to help his lower back. It's going to help his hip flexion. It's going to help his internal rotation in his hip. This is going to help his hip flexion. This is also going to help maybe the way things flow in his organs and his intestines and his gut health and all these types of things. So it's just not one little point that's having that's getting released. It has this cascading effect, this really positive outcome. So there's number 3, pectineus. We're trying not to waste too much time. Number 4 is, of course, our adductor. So maybe, Leo, you come round from the other side and get some better lighting. So we're going to go brevis, isn't it? Or is it magnus? What's our main tendon?
It's going to be sore. We go under gracilis and then you can go down into magnus.
Yep. So just for the video's sake, really ropey, tight one. That's the one I like to just have a bit of a feel. Ninjas is really tight. So connecting, not giving away too many of our tricks. We've got a mentorship here, but into here, right into there is where these insertion points are, and like down in low there. So I'm going to be putting my elbow next to that. Soften it just because he's a bit tight in there, and use a broad part of my forearm rather than my elbow yet. And connect in.
Feels good.
Yeah. And of all the money spots, I think this one, and maybe the one we'll get to later in the video, is probably the most important. If I had to treat 2, this is one of the 2 in the hip, isn't it, man? Yeah. Just it just has such a profound effect. It releases so much pain or discomfort, or if you're feeling like you just can't bring your hip up or in, you release here. It just gives this whole freedom of range and just this power back into your hip, this strength back. Sometimes having kinks in the tissue, which is essentially what happens when there's adhesions or build-up or the fascia gets sticky. Releasing and dissolving that allows that neuromuscular connection, that brain-body connection, where we're actually allowing those neurotransmitters, like the guys that are basically talking to that muscle to switch on. There isn't any speed hump. It's just a really quick impulse. We're getting those really fast responses without having to, picture driving your car, slow down on a speed hump. It's just like really quick. And that's what's happening when we've got smooth, clean tissue all the way down. So this one, pinning that adductor.
Yeah.
Getting a bit deeper now that we've spent the first minute sinking in.
Yeah, buddy.
Now we're in, and it's no elbow yet, it's still forearm.
Yeah, that's it.
And then,
you're hooking under, that's good. Under. You're right, you're slipping.
Slipping, there we go. This is a really good one for osteitis pubis pain or pubic pain, or just general groin or adductor strain or injuries, or just tight hips. You got tight hips, treat your groins. You got lower back pain that's nagging, won't go away, treat your groins. Get into adductor magnus. I'm going to show you now that I've used my forearm, more of an elbow. So I'm going to go up and then there.
Whoa.
Yeah.
Ah.
Yeah.
Gotta breathe a bit.
Beautiful. Yeah, I reckon I treat, if I see 30 clients a week, I probably treat at least the groins at least 10 times.
Yeah.
Yeah.
It's big.
Yeah. A third of my career is spent treating groins. I reckon it'd be up there.
Yeah.
It's at least in between a quarter and a third. But I enjoy it and I get so much out of it. And my clients, they might not love it at the start, but geez, they love it afterwards, walking out of here with that smile on their face.
Yeah.
Just got to wait for that to release. It's got a bit on it. Beautiful. All right, let's move on to our TFL. So we're going to lie on our side, Ninja, face out the window. Oh, good, bro. I'll get you. Yep, just like that. I'm going to show you right in there. So this guy is a small little muscle, another hip flexor, an internal rotator, and can also assist, well, sometimes it plays the role of the glute as a abductor, but we want our glutes creating that force, and that's why this guy gets angry, is weak or dormant glutes or lazy glutes. So I'm sure a lot of you can resonate with pain that you felt in your TFL. Jeez. And Ninja can feel it now.
Yeah.
Really good money spot. If you're a runner, get this treated. Get on a ball. Get your practitioner or come in. Get some treatment from us. You will not be disappointed. And we are the best at it. We find the spot right away. There's no
Stuff around.
5 minutes to find it. It's 5 seconds and we're right on it. Double thumb to just get some reinforcement there, but also as a practitioner you want to make sure you're looking after your tools, and this is me just looking after my left thumb that's doing 90% of the work. 2 minutes in this spot is about the right amount of time, and sometimes that 2 minute as a receiver feels like forever.
Yeah.
But when you get closer to that 2 minutes and it's about 1:40, you can start to feel the benefits.
Relax.
Yeah, it's horrible.
Yeah.
We get referral pain into our shin. So our IT band, which is that really thick, rubbery connective tissue type tissue, it is basically it's tendon of that connective tissue. So if you've got lateral knee pain, again, we're talking money spots. How is this having more effect on just this area? We're going to help with our knee pain. We're going to help with the way our quad functions, and we're also going to switch off an overactive TFL that might be doing too much work for the glutes. So switch this guy off, go train the glutes. Hips start to feel a little bit better. Well, a lot better. There's probably closer to that 2 minutes. Ninja can start to relax a little bit.
Yeah.
Tight hips, man. Back into Lift Club Monday, was it, that's got ya?
Yeah. Yeah. I'm back.
Yeah.
I was pain-free this week, so I was good. Last week I was still feeling it. Yeah, but I kind of was conservative again this week and did circuit last week and a circuit this week. I think that helped to loosen me up a bit too.
Yeah.
Sprints, I was stiff. Like on Friday, just gone, like couldn't run properly, but I was still out there pretty pain-free, but just couldn't twist, through the lower back.
Yeah.
Yeah. Whoa.
Hold it, weight with weight, pin. I haven't moved. Little angle changes or direction, but other than that, we sink out. You can see exactly where that thumbprint is, so you guys can get a good understanding. You can see his TFL. Look at it. Bloody strong, mate. Good looking TFL. All right, let's get you on your stomach. I'm going to show you the last two. This one now is number one, and it's our lower back money spot. Where is that? That prick down there. Not used to this table. All right, so I'm going to come on the left side. You'd be good at that, Ninja. You like coming on the left or the right? Either, whatever. Yeah. All right, there's no warm-up. I'm just going to go straight into our lower back money spot. So our thoracolumbar, we've got really dense, thick tissue down here. So what I'm going to do is go really close to that SI joint, our sacrum. See if I can come off the ledge of our sacrum and then sink down into our lumbar spine.
Oh,
how was
clunked.
That was bloody beautiful.
Felt good.
Felt good.
It's a deep clunk, wasn't it?
Yeah, it
probably
was,
needed
man.
that. I mean,
Just a bit of traction. Just you could feel maybe the vertebrae was just sitting off a bit and it's just clicked in. Don't know if we got that on camera or the sound of it, but turn the volume up, go back, turn it up. All right. So angling in, pushing down, working towards his opposite glute. So working towards his left glute, his right glute, even though I'm treating his left side. And it does take a minute to get in there.
so is this one in your top two? Or?
Top two, this is number one.
This is number one?
This is number one, yeah. So those that followed along, number two was our adductor. This is number one. Talking about money spots, this can help release pretty much anything within the body, I reckon. Like this can help you with your neck pain. This can help you with your calves. This can help you with your glutes. Yeah, because we have these really thick nerves that come out of here that play... that have a lot of, like they're responsible for feeding the muscles, for communicating with the muscles in our hamstrings, in our calves, in our feet. But then our thoracolumbar fascia, our posterior chain, which is this fascial connection, like that connects us from here all the way up into our head, but also to the bottom of our foot. And this area here is probably the area where we find our fascia is the thickest, the most dense, the most solidified, because it needs to be, because our lower back needs to be stable. And it needs to be strong because we don't want to injure this area of our back because it's so debilitating that we can't really function through life. I think the body knows that this area needs to be protected and guarded. So it downlays a whole lot of fascia and thick, strong muscles in this area to protect and guard it. But if we are dehydrated in here, which Ninja's not dehydrated, he sprints and runs and sprints and lifts and gets regular treatment. But if you're somebody that just does a lot of sitting, doesn't get a lot of treatment, doesn't have a good diet, all these types of things, you're going to be pretty dehydrated and pretty solid through here. And this is releasing this on somebody that hasn't had much work in here before is just going to be like so eye-opening. It's going to be life-changing for you. So lower back money spot, number one on my list.
It's good.
Focusing a little bit on the treatment here. I feel like I can do both treat and talk, but it's a pretty... This one's probably takes... You never perfect it. We're always trying to work on getting the angles right and making sure we're in the right area and cleaning it out, doing a really good gouge and scoop in there. Scoop the bastard out.
Yep.
So yeah, hip pain, nagging, lingering, feeling like you can't get out of first gear. We've shown you our top 6 spots. This is number 1. 1 of 6, a lower back money spot. We'd spend time on both, but I'm going to show you now the 7th, the final one, and that's glute med. So ilium, use my elbow, and then I'm just going to get a little bit more glute out. Pin. Our glute med is working really hard to keep our pelvis stable. It stops us from like falling in and out of when we're running, like getting this sort of like duck bum wobble. So it works really hard. It does a really good job at stabilizing our pelvis and keeping us upright, but it also needs to be released because it's doing so much work. You know, it's your hardest worker on the tradie site. He needs the biggest meal, the most amount of water, the most amount of love. That's our glute med. So pin, hold, keep slipping. Yeah, find the right spot. Is it more angling down or up? Hold that. Again, another spot that you're going to help unravel pain that you might be feeling in the hamstring. Maybe your lower back sore. This is going to help with your lower back. It's going to help with your hamstring. It's going to help with some sciatica type symptoms. And again, you're just going to get this nice, flowing, functioning hip when we run, we walk, we jog, when we're in the gym moving, or just everyday function. So pin, hold, work it, dissolve the tissues, hit the right spots. Don't mess around with your skin polishing. All right. So they're my top 7 hip money spots. Lower back and hip money spots. If you've got hip pain, if you feel like you just can't get out of first gear, or you just got, I don't know, discomfort or an injury, come in, book in with one of our practitioners here at MMT. We've got a clinic in Richmond, we've got one out in Ferntree Gully. We'll make it worth your while. Book in online, see one of the best practitioners in the world. Yeah, thanks for watching.
Get it done. Thank you.